Hello viewers and my dear students, welcome you all in today's live class. I am Divya Pandey, nursing lecturer, IJSCon from rgcsk.edu. So before leading ahead with our live session of today's, I would like to wish everyone a happy International Nurses Day 2026 to all the nurses all over the world who are working and caring for the patient, serving for the nation and for the state and for our profession. So wish you all a very happy International Nurses Day. So our today's live session is on CNE, Continued Nursing Education, which we all know from our first year. In every semester or every year, this topic mandatory it is there. Continued nursing education, and it is one of the important topic of nursing education subject, whether you are in GNM, B.Sc or in a master's or doing the PhD. So continued nursing education cannot be stopped at any place. This is all about in this topic we are going to discuss about the many things that we will see in the learning objectives. What is the main learning objective of this class? So first, by the end of this session, the student will be able to understand and will be have a knowledge on the topic, like what are the definition of continuing nursing education, capable of introducing the nursing education, continue nursing education, explain the importance of continuing nursing education practices, identify the different types of continuing nursing education. In that we will going to study about the what are the formal type, non-informal types, and describe the various method of continuing nursing education. And we also going to discuss about the benefits for the nurses, for the system, for the nation. A few more points are like recognize the challenges faced in the continuing nursing education, because whatever we are planning and whatever the things are there, there will be some cons and cons will be there. So some of the difficulties or barriers we will face in conducting or organizing CNEs, we'll discuss on that. Also understand the role of a technology, how technology is evolving and helping the people to conduct the continuing nursing education, how helpful the technologies are or how they are making the work as an easy things. Then explain the role of a research in continuing nursing education, how research studies, those are things involving and helping out the nurses or the organizers who are organizing, whether in the academic area or in the hospital settings. For our workers, this is basically for those who are already trained. So after completion of training, we feel like we don't have to study much, but there is a advancement or there will be new things are coming, new machines are coming, new updated studies are coming. So on that we need to have a continuing nursing education. And then application of the evidence-based practice in continuing nursing education for the decision making process. Next, we'll start with our topic, continuing nursing education introduction. Continuing nursing education, CNE refers to a planned educational activities which are designed to maintain, develop, enhance the knowledge, skill and practical performance. So these are in a design form, in a systematic form, like we cannot jump on a last in. First we need to do a planning, like how many participants will be, how many trainers will be there, so what will be the schedule will be there, what will the budget and agenda will be there, so who is going to lead this session. So these are the planning has to be done. So that's why it is called a systematic or a planned process. Continuing nursing education is not limited to a formal classroom learning. It is including workshop. It is not like a bunch of people sitting and having a lecture come discussion type of a class. It could be in a many ways, like a seminars can be there. It could be a paper presentation. It can be a scientific paper presentations, online courses, conferences, workshop, webinars, simulations. These are things which can help out the trainees, those who those nurses who are been completed their course in 2000. Now it is 2026. So like many evolution is done, many technologies has came in the healthcare system. So how they are coming up with those things, how we are training them. So it is all about, CN is all about, like it is an upgradation of the knowledge. Next, in a modern healthcare, knowledge become outdated quickly due to rapid technology advancements, emerging diseases, new treatment protocols. If you'll see in a modern time, every day if you'll go for a research things article you are studying, you will see the new disease condition, new treatments, new technologies are coming, new patents are there, people are, some inventions are there, so they are doing the patent. This time in a research it is going on the patent for some machines they are making, some checklists they are making, some of the scales they are forming, so they are doing the patent on their names. So it is also coming and emerging. So every time things are being changes, so we need to be updated on this. So basically on this purpose, the CNEs are very important. So therefore the CNEs ensures that the nurses remain competent and up to date with the knowledge, skill and the things like what are the upgradations are there. In our curriculum also there is a upgradation and changes or modifications are there. So if we are like old nurses, or so we need to get upgraded, like if the professors are there, teachers are there, we need to teach our new children in a first semester. We had been completed in 2000, so we need to get ourselves updated according to the 2026 curriculum. It is all about the CNE. Next we are going to see like some definitions are many more definitions are there, so I picked out some few definitions. Here we can see that according to the American Nurse Association, CNE consists of systematic learning experience intended to build upon the educational and experimental basis of the professional nurses. It is according to American Nurses Association. The second definition I stated as an according to B.T. Baswanthapa Nursing Education book. Continuing nursing education is a lifelong process that enables nurses to update their knowledge and skill in response to exchange healthcare needs. Means it's never going to stop. If you are working also, you are getting a good job in a government hospital, then also you need to update your knowledge in some of the diseases. For example, if you are working in a labor room, every time the WHO is giving, our INC is giving, some of the changes are there. According to the research studies, some of the changes will become, some of the programs will become, some eradication programs will become. So we need to upgrade our knowledge on that speciality things. So it is a lifelong process. According to World Health Organization, continuing education is essential for maintaining the competency and improving the quality of healthcare services. Like if we are not upgrade ourselves according to the present things, we won't be capable of taking care of our patient or capable of giving a good services to our patient. So this is very important to have a up-to-date knowledge. Here we'll see about the definition. Next we'll see what are the importance. Why do nursing education, continue nursing education is important. Even though we had been completed our full curriculum, we got the job, we studied, then only we got the opportunity to get job, a good job. So why it is important? Healthcare is constantly changing. Like if we'll see the type previously how the ward settings were there, at present time how the ward settings are there, previously how the like patient centered care was there, now it is a holistic care is there. Holistic, like only we don't have to see the illness of the patient, we need to see the patient all around, like whether their spirituality, whether their physical health, mental health, then emotional, we need to have those in a combination holistic care we need to provide to the patient. Not only we need to see about the illnesses. So new diseases are emerging, or the diseases which are increasing in numbers, like so much of numbers are there. So new technologies like new machines are there, even AI is coming to our healthcare sectors. So learning those things, then new treatment guidelines are changing, like according to the how the prominent the conditions are there, how the cases are increasing. According to that some pharmacological studies are also there, the new drug advancements are also there, drug ingredients modifications are there. So we need to change our in like every day we need to study. If like drugs are there, in a drugs category also we need to study the method of, for example, we can take a very easy example like hand washing steps. So WHO had been previously given 7 to 8 steps. Now the few steps has been removed from the hand washing, like that general medical hand washing, that few steps are being removed. Why? According to the research studies, why some points had been found that sometimes the infection can transfer from the one area to the like less contaminated to the more contaminated area. So like this updates are coming. For example, we can see for the biomedical waste management, previously how it is was. So now it is being changed. The blood things, whatever the content is there, if any blood stains are there, it has to be going to the yellow bin. If any plastic rubbers or tubings are there, it has to be going the red bin. So there will be updates will be coming, and it has to be followed by all over worldwide. It has to be followed by the people are working in the health sector. So this is a very good example. We need to change. CNE ensures the patient provides safe care. So if we'll have the updated knowledge, we'll provide a quality of or a safer side of a care to our patient. Avoid outdated practices, which are old practices. We can we can change ourselves, or we can skill ourselves to the new practices or updated ones which do have the evidence based practice. We do have the rationally behind that, which are scientific rationally. Improve patient outcome. So if we'll follow those all things, there will be a good outcome. The patient, the healing process will be fast, recovery will be fast, and discharge will be early. Next, we'll see what are the principles of CNE. So, lifelong learning, relevance to the practice, learner-centered approach, evidence-based practice, flexibility, active participation, evolution and feedback, interdisciplinary collaboration. These points we are going to see in a step, like one by one. First is lifelong learning. Like the learning, for example, in learning we had been studied, it never stops. From the time the mother conceive a baby in a womb, the learning start from there until the last breath or till the death, it will be continue. CNE is a continued process that support nurses in updating their knowledge and skill through their professional life. There will be a professional learning. It is a kind of a formal learning, learning. There something will be, it is a planned form, or in the areas where the nurses are weak or the knowledge is lacking, in that area will have the process. Next is relevance to the practice. Educational programs should be directly related to the clinical practice and current healthcare needs. And whenever the person or the people or a group of a committee who is planning for a CNE, continuing nursing education, they should be planned on specification, like what are the needs. If in an academic side, if in a nursing college, if you are planning some modalities are there, some ethical clearance, like some programs are coming, some rule and regulations are changing, some practices are changing, something coming new, we need to update our teachers so they can be guiding our students. So it will be in a huge, we can guide our student. When CNE is conducted in the hospital side, the like if any disease condition is coming, any new surgery had been happened, any new machine had been coming, medications are coming, some modalities are being utilized, something is changes, or new machines are like dialysis machine is there, so many upgradations are there. So in that we can have a skill lab on that, we can conduct for our nurses. Next is the learner centered approach. Learner like on a specific person, like our nurses are there, or specification we can do like ICU nurses, surgical ward nurses, labor room nurses, pediatric ward nurses. So focuses on the needs, interest and experience of nurses to enhance their effective learning. We need to see the place, we need to see the person, those who are wanted to change their knowledge or wanted to upgrade. Next is evidence-based practice. Evidence means there should be a rationale, there should be a scientific background behind everything we'll do, we say, or we practice. Content should be based on the latest research guideline and best practices which are being proven. So we need to utilize those things. And then flexibility. Flexibility is simple meaning at any situation it should be changeable or modifiable. We can change, we can modify, or we can add upon things. So programs should allow the flexible learning methods like online courses, workshop, and self-paced learning. Sometimes some of the apps are there. One of the app is Cursed, CURED. One app is there, so you can utilize that app. It is having very short sessions are there, like hand washing, gowning, gloving, IV drug calculation, dose calculation. It is having 5 to 10 minutes of session you can attend. You can give the exam of 5 to 10 MCQs, and immediately you will get your certificate, and it will be like allowed for a 1 year for validation is there. So these are like online courses. So whenever you are, or the nurses are getting time, or the faculties are getting time, they are utilizing in their free time. There won't be any fixed hours, so like 8 to 9 you have to do this. There is no fixed hours, so it is also very easy for them in their time, in their free time, or they are in a recreation time, they can have on that process. Workshop, like there will be a good exchange of a knowledge, like experts will be there, or from worldwide the nation the expert can come, they can tell the scenarios and the things of their own nation. So it can be of a good exchange of a knowledge. Next we'll see the active participation. Encourage involvement through the discussion, simulation, and hand-on training. Means if we'll have only the lecture or a discussion classes, it won't be that much motivating for the nurses, because everyone feels like, even if we'll talk to the old nurses, everyone feel like they do have the knowledge enough better than the present generation. But when it will have the motivation, or will allow them to present something, or having the skill on hand, or teaching something, be allowing them, so it will be quite better for their involvement if we want to enhance their knowledge. Next is evaluation and feedback, and whatever we are doing, that evaluation has to be done, like there should be a checklist or continuous assessment to improve their learning outcome and program effectiveness. If we are doing something, we should know the results. So we should be capable of knowing whether any improvement is needed or any other sessions are needed on this thing or this program on this topic, and feedbacks like areas of improvement. Some positive feedbacks has to be given, and areas of improvement also need to be set to the particular trainer or particular trainee or particular nurse staff, and some hand materials also need to be given on that specific training. Next is interdisciplinary collaboration. Promotes teamwork and learning across the different healthcare professionals. Means interdisciplinary, having a teamwork, like if the doctors are there, nurses are there, some junior residents are there, senior staff nurses are there, or from the collaboration with the nursing colleges or the paramedical colleges, they should have a collaboration and exchange of a knowledge can be there. So it could be a good exchange of a knowledge, and good teamwork will be there. Knowledge enhancement, skill on a hand can be processed. Next we'll see these all were we had been discussed about the principle of continuing nursing education. Now we're going to see about the needs of CNE. Why do we need CNE? What are the importance? Keep knowledge updated, means according to the present scenario, present curriculum, present condition, present technologies, our knowledge updation. Improve patient care quality. Quality assurance will be there if we do have the updated knowledge. Then professional growth in our own self. For individual, we are having a growth for own self because we are having updated knowledge. Adopting to the technology advancement. So adopting to the new thing is a quite difficult task, but if we'll have the training skill and the people to teach us, it will be having helpful to adopt the technology, and then further it will be helpful for individual to deal it individually or by own. Meeting regulatory requirements. What are the on a regular basis requirements are there? Some handouts, some content or training like PPTs are there, handouts are there, so it will be helpful for the people. Enhancing critical thinking skill. Critical thinking, it will become by the knowledge, experience, and when you will have the collaborations. Building confidence and competency. Competency is like skill on hand, like basically on the procedures, and if we'll have the skill trainings, like for our student we do have the procedure demonstration or skill stations, and we are doing the demonstration. So it is all about the being the competent and having a skill on your hands. Addressing emerging healthcare issues and awareness about the whatever the healthcare issues are in a present time. What are the surveys are ongoing, what which disease condition in which state is leading, what are the medication is being prepped for any disease condition. So this is the basic needs for conduction or having a CNE in each organization for the people who are already being trained. Next, we'll see about what are the type of continuing nursing education program in how we can conduct. So it could be a formal education, informal education, that is also known as self-learning, in-service education, workplace training, means when you are doing job and you are having some training sessions. This is known as in-service education. Continue professional development, that is known as CPD. So these are the type of continuing nursing education. We'll see about first one is formal education at education like self-learning. In this like formal education refer to the organized, planned and institutional based learning. For example, we can see the certification course like our B.Sc nursing, A&M nursing, GNM nursing, degree courses, diploma courses, post graduation courses are there. So they do have some curriculum we need to follow, like INC is giving us curriculum, we need to follow that curriculum. On the basis of that, our exams will be there, our semester exams will be there, our practicals will be there, and we need to fulfill the requirement or the whatever which is given by the INC and our universities. So this is in kind of formal education which is happening inside the classroom and the clinical areas. Next is all about the informal education. Informal education is like self-learning. Informal education is a self-directed learning that is not structured or institutionalized. Means there won't be any specific curriculum or there won't be any classroom. So it is flexible, self-paced, based on individual interest. Like for example, if I'm interested in pediatric nursing, I won't go for psychiatric nursing. If I do have, after B.Sc completion of my B.Sc nursing, I do have interest in pediatric nursing or in a child health nursing, so I'll have a focus on that. I can choose my specialty on that basis. I'll go for, like, if I want to join anywhere, I'll ask for the pediatric wards. If I want to go for the academic side, I'll ask for the pediatric departments. So examples we can see: reading journals, articles, watching educational videos, online learning, YouTube apps, self-study. Even in a present time, if we'll see, like some people are having their own YouTube platforms or channels. They are having some content on that, like educational content. Sometimes they are making some small videos on procedures. uh, and sometimes if someone is teaching us, it will feel so boring. But if we'll scrolling our phones and learning by things according to our interest, it will become more easy. And like in a present time, every people do have the cell phones, androids, so they can assist to have the online search, like article in general. They can even writing the article. Now at the present, technology is so helpful to us, like we can get a proper some samples of how to write, how to search, like what are the platforms are there, like PubMed and all are there. We can have a see the articles, read the journals. We can also have write like narrative review types. We can also write our own. So this will be developed from the informal type of a, education, if we are interested enough to have knowledge. Next is in-service education, or we can say as workplace training. In-service education is a training provided within the hospital or healthcare setting to improve the skill of working nurses, those who already in a job, and we need to improve their knowledge level, their upgradation or modification of knowledge. So it is in a practical, job oriented and short term, like for a some in a month, in a 6 months, some CNE programs will be there. So examples like hospital training session, skill demonstration, orientation programs, infection control trainings. So like in a hospital at a present time, infection control nurses are appointed. They do have a duty to train our nurses, like basically about the infection control, how to do the waste management, how to do the BMW, how to put the injection, how to set the trays, how to care for the patient, how that hand washing, that routine has to be followed on these all things. So it can be easily have a session, like whether it is a private hospital or a district government hospitals are there, we do have the CNE or in service education programs. Next is continued professional development, that is CPD, refers to the continuous professional learning activities that help nurses maintain, enhance their competency. It is an ongoing, career focused skill enhancement. Like we can see, you will have the vouchers, or you can see along like conferences, our national conferences, international conferences, workshops, seminars, skill development programs. Even to our UP government, like UPSMF is giving the opportunity from the colleges, like two people can have their sessions free of cost. It will be the skill webinar session for 4 to 5 6 days. And many colleges are conducting state level, international conferences are there. We can also apply for all offline online modes are there. So there will be a good exchange of our knowledge if we'll attending those of the conferences and seminars. Continue professional development, different ways of learning happens, like with the lecture, if we'll work on the theory sessions. So theory knowledge will build a strong foundation. If our theory is called as a base, that's why before going for the clinicals, we do have the theory portion, because in a theory we'll learn about the basic of that thing. Then only we approach for the demonstration or a clinical side. Then the workshops are like skill practices. Skill practices allow the hand-on practice and to develop and enhance our skill in a procedure. Like we know about hand washing, but until we are not doing the proper steps of hand washing in our laboratory and nearby the patient when doing the care, we won't be capable of learning those specific steps. Next is simulation. Simulation is like real life scenarios. We do have the dummies at the present time. Working dummies are there, which we can do the IV cannulization. We can the IV fluid in starting of the IV fluid. We can give the IM injection, IV injections. We can do the palpations like antenatal palpation. We can see, we can hear out the fetal heart sounds in our dummies. So this is simulation, which can give a real life scenarios to the students. So before sending into the clinical side, we can have a skill labs for our students. Next is about e-learning, flexible learning. We can, or flexible training, we can say. Some modules will be there, like our UP SMF is also giving some of the modules which are online safe. You can just have to go, you need to search on that, you need to register yourself, and you need to carry on that. Next is about group discussion. Group discussion is a critical thinking process. When a group of people are sitting, they do have the different sorry, they do have the exchange of ideas and knowledge. So sharing and having a teamwork on a one thing, we do have the many ideas, so we can build up, or it could be a time saving, it could be a knowledgeable sessions. Next we'll see about the benefits. What are the benefits of continue nursing education for nurses improves their knowledge or update their knowledge, build confidence because they are updated with the knowledge, and career growth will be there in their career. If you are aware about everything, if you are just surrounded with your, like you are coming to college, you are teaching, that's it. And if you are working in a hospital, you are going and doing your 8 hour of job and just going off, so there won't be any career growth or development. You can also enhance like knowledge, you can also further go for other professional development. Next is benefit about for the patient. If you'll updated or the CNEs are there, then what are the benefits for the patient? There will be a better care from the side of the nurses, there will be a safety, there will be a faster recovery and early discharge of the patient. Next, benefit of the CNE for the system. For system, we can see healthcare system or organizations like reduce errors because we do have updated knowledge, we do have updated skills, we have competent enough, we are confident, and it can improve the efficiency, the way we work and the way we carry out the works. Next is recognize the challenges in CNE. If we are conducting or doing anything, there will be some barriers or some challenges behind, like lack of time, because everyone is having fixed working hours, 8 hour of duty or a change of a duty. So if we have to conduct a CNE, it should be a plan. So lack of time will be there. So better to have a planning on that. Heavy workload, because if you'll see about the nurses in a private or a district hospital, everyone is overworked because the patient, we cannot count on how many patient can come. So it depends on the how the patients are coming. So heavy workload is there, financial issues will be there when organizing the CNE, and because we need a trainer, we need a well qualified person who can train our nurses, who is certified. Even some of the courses or training we need for our nurses or for our faculties, we need a certification course if we are attending any kind of training. Then limited access will be there, like if one day we had been planned, then in flexibility won't be there because it is a planning process. Next, role of technology in CNE. How technology is evolving and helping out for the CNE. Technology has changed learning. Like online courses are there. Previously, like we need to search on the books or in a library. But at the present time, we can Google it things. We do have the AI support, online webinars, wherever the place is there. Offline, online also we can attend. Zoom meetings are there. We can attend with the mobile apps. We can attend the things. So one advantage is that like we can learn anytime at anywhere, whether we are working, whether we are traveling, or we in a home we can also sit and have our learning sessions. Role of research in CNE. How research in helping out or improves research improves nursing practices, patient outcome, clinical decision making, because we do have the evidence or the rationale on the specific things. So here the nurse's role is read research article, apply findings, participate in the studies, even like scientific paper presentations in a research review writings, nurses are being participating in this. Evidence-based practice. Evidence-based practice is all about the research evidence, clinical expertise, and patient preference. So for example, we can see using updated infection control guidelines, we can reduce the infection in a patient. Like we know how hand hygiene has to be maintained, how we need to care for the patient who is having communicable disease, how we have to patient who is having like hepatitis B patient is having. So personal protective equipment has to be weared, and the discarding of personal protective equipment, those all things, if we do have the updated evidence based knowledge on a practices, we can have a change in the knowledge and care of the patient. So till now we had been discussed about the CNE, their introduction, definition, we seen the importance, principles, needs, and we had been seeing the different type of CNEs, involvement of the technology, how the role of nurses, role of patient, and the benefits, some barriers we had seen, and evidence-based practice in the field of CNE. So overall, I want to say that the CNE is a lifelong learning process. Even though you are working, you are earning good, their learning is required for updation of your knowledge, skill, improve knowledge and patient care. If you do have the knowledge updation, you will be capable of doing good care to your patient. Research and evidence-based practice make the more care, make more scientific, more rational. Technology makes learning easy. Like we do have some equipments we have in our hand, we can like every time we don't have to go for a search in a book. Sometimes we cannot capable of carrying some of the heavy books in, like, if you are traveling, basically you won't carrying your study stuff. So if you do have the cell phones, mobile phones, you can search on that. You can, or while traveling also you can attend many things. So it is all about continue nursing education. Thank you, and I hope you had a good knowledge on this CNE topic. And for like this topics, please like, share, subscribe our YouTube channel rgcsk.edu for more live classes like this. And if you do have any suggestions for any topic, you can also give in our chat box. And happy International Nurses Day to one and all. Thank you and have a good day.